honor of May being Older Americans Month, we wanted to highlight a health concern many seniors don't consider, and that's their oral health. So here to discuss some issues common among older people and everybody else, we're happy to welcome back from Aspen Dental, Dr. Landen. Tutt, good to have you here.
Thank you.
May is Seniors Month, and I would guess for seniors, there are some dental concerns that maybe you when you're younger you don't think about.
Absolutely, yeah. There's many concerns and dental issues that are specific to the older population. The one that I see most often in my office that really has a detrimental effect is dry mouth. Many times the older you get, the more medications you get on, your doctor's prescribing you more and more, and one of the major side effects of many of these medications is dry mouth. When you don't have as much saliva, there's not as much of a flow of saliva in your mouth, it doesn't wash off naturally the plaque and bacteria that builds up in your mouth. So cavities grow at an exponential rate.
Oh.
And the typical brushing and flossing that used to work, you get on a couple new medications and no longer is enough. And so people say, you know what, in the last couple years, doc, my mouth just started falling apart. My teeth, I'm getting cavities left and right. What happened? And my first question is, are you on any new medications? Does your mouth feel dry? And so that's one of the biggest ones. Other things, if people have ill-fitting dentures, sometimes they don't break up their food as well, so they have poor digestion. And so that can be an issue. They need to get in for a denture fitting or for adjustments.
What do you do, though, for dry mouth? I can understand how common that would be. What can your patients do?
Well, there are many products out there. You know, there's a Biotin has an entire line of products for dry mouth to help stimulate saliva. Chewing on sugar-free gums, sugar-free mints, just to naturally stimulate saliva is good. You really have to up your oral hygiene, though. And what used to work didn't work, so you have to brush maybe 3 times a day. You need to really use more fluoride every single night, and sometimes you need a prescription-grade fluoride toothpaste to counteract the damage that's happening during the day. So part of it's just more diligence. Other parts of it is actually using medications.
Can your dentures just age on their own? I mean, can you tell when it's time to get new dentures?
Yeah, there's normal wear and tear. One thing, I mean, your mouth, little by little, you lose bone, and so your gums shrink, and so the dentures will fit more poorly. They'll get more loose. They'll actually start falling out more easily. But then also the teeth wear down, so it's harder to chew your food if your teeth are very smooth and flat, as opposed to actually having some cusps on there, or having teeth on your teeth, is what I like to say. So people will come in with dentures that are 20, 30 years old. They're nice and flat, and it's just hard to break up your food.
And seniors aren't the only one wearing dentures.
No, absolutely not. I have many patients that are, even under 30 at times, that end up needing dentures due to sometimes to life choices or sometimes accidents, different reasons, and they can't afford the nicer options of implants and crowns. And so dentures, there's over 35 million Americans that are going around without their natural teeth, and about 15% of those every year are having dentures made, according to the American College of Prosthodontics.
That's like 10% of the population with dentures.
No, without their natural teeth.
Without their natural teeth, okay. But, and I've always thought dentures were a last option when nothing else would work. But what I'm hearing you say is it might be more of a budget.
Absolutely, yeah. I mean, if everybody could afford implants and crowns and bone grafts, that'd be great, but it can cost upwards of 50 grand to get a mouthful of implants and crowns, and that definitely doesn't fit most of America's budget.
Right.
So dentures are a wonderful second option that can, give you something wonderfully that's aesthetic. It helps you chew, it helps you smile, and serve the function that teeth are supposed to serve.
Any tips to help patients with new dentures help them smile right away?
Yeah, absolutely. It's like getting a new pair of shoes. You do have to kind of work them in. The more you wear them, the more you practice, the more your mouth will get used to them. When you first get a new set of dentures, you salivate a lot, so the more you wear them, the better it is. You need to practice reading out loud, talking out loud, speaking out loud. But most importantly, if you get a sore spot, don't just try to get used to it. Go to your dentist, have it adjusted, and that's what we do at Aspen.
And it can be adjusted.
Absolutely, yeah. I'd say 90% of dentures.
Are today's dentures different than your grandfather's dentures? I mean, do they fit better, hold better? Remember there used to be the commercials for all the products to make your denture stick so you could eat corn on the cob. Is that really an issue still?
It is. I mean, it still is an issue. I think the impressions materials are better. They're a little bit more comfortable. They still taste horrible, unfortunately, most of the time, the impression materials. Some of the basics are still in place that were there 50, 60 years ago with dentures, but I think places like Aspen have really made it more efficient in terms of how easy it is to get in, to get it adjusted in order to get it made in a timely manner.
You also have a money-back guarantee, right?
We do. So sometimes patients, no matter what we do, at times we just can't get it quite right to the patient's satisfaction. So something we've been doing at Aspen for a long long time, but now we more have a formalized process of it. Is if they're just not happy with it in the end, we give them their money back as long as they return their denture to us within 90 days of the refund.
Oh, very good. If you'd like more information, easy to do. Give Aspen Dental a call, 800-ASPEN Dental. That's 800-277-3633. And we'll have the link on our website at KATU.com. Doctor, good to see you.
Thanks.
All right, do you like to fight dirty or do you keep it clean? Coming up next on AM Northwest, learn how to fight right to keep